There are so many reasons why infertility may happen, and you may be wondering, what is the most common cause of infertility in females? And we're going to talk about that today. I'm Dr. Perkins, a board-certified OBGYN, and I'm so happy to welcome you to my channel. In today's episode, we will talk about the most common cause of infertility in females. We will talk about the most common causes of anovulation or not ovulating at all. And we'll talk about how PCOS affects your fertility and what you can do about it. The female reproductive system is one that is quite complex. It is a very extensive system, and when it works well, it works wonderfully. And when it doesn't work well, it causes a lot of aggravation and frustration, and sometimes it may even play with our moods and anxiety and depression because, you know, as females, we want to reproduce if we desire to, and anything that may cause a problem with that really hurts us. And so let's talk about some of the most common reasons, and then I'll tell you the number one reason for female infertility. Join me here on our whiteboard. We'll talk about the female reproductive organs. And so let's start by drawing my uterus here. This is your uterus. The uterus has this little point at the bottom, which is the cervix. Together, this is called your uterus. And connected like arms on the side are your two fallopian tubes. Very much close to the fallopian tubes, right at the end here, are your two ovaries. Below your cervix is your vagina, and all of these parts that you're seeing here are very, very important in allowing fertility to happen, which means egg and sperm needs to meet together. Sperm travels through the vagina, through the cervix, through the uterus, into the fallopian tube on both sides, but only the side that has the egg will fertilization happen. Fertilization always happens in your fallopian tube. It doesn't happen in the ovaries. It doesn't happen in the uterus. It definitely doesn't happen in the vagina. It happens right here in the middle point of your fallopian tube. With that, in a female, it is very important that your ovaries work, that they're producing mature eggs, that they're producing estrogens and progesterones, all of the things that are needed to cushion, prepare, and help the uterus, what is called a conceptus, or after egg and sperm meet together, before you get to a fetus stage, it is called a conceptus. The conceptus together, egg and sperm together, AKA, travels together and then implants inside of the uterus where an embryo will grow that will eventually lead to the fetus. The importance of the fallopian tube is for egg and sperm to meet. Your fallopian tube does not produce hormones, does nothing else. Literally, it is a bridge from the ovary to the uterus and allows sperm to travel to meet the egg right here. The uterus is very important because this is what houses the growing baby. This is what contracts to allow birth to happen. This is important. Your cervix has a very important job in pregnancy. It must remain long and thin and closed. This is important all the way until the end of pregnancy when labor starts. At that point, this cervix will open up wide enough to allow baby to pass through the vagina and to come into the world. With infertility in females, any part of this cycle can become problematic. If the ovaries are not producing eggs well, you're not able to get pregnant because you're not producing eggs. If there is a blockage to your fallopian tubes, this can be caused by a lot of reasons, including having things like endometriosis that can cause a lot of scar tissue to be built up inside. Sometimes that scar tissue can block the pathway of sperm coming in and passing through to get to the egg on the other side. If there's any blockage at all to the very small fallopian tubes, then pregnancy will not occur. If you do not have a uterus, because you had a hysterectomy, you're not able to get pregnant, obviously. If there is something inside of your uterus, like a large fibroid, that will prevent you from getting pregnant. Sometimes you may have something inside, which is like a polyp, which is a long slender, soft piece of tissue, but enough to block sperm from getting through. Literally anything that may block sperm from getting through may prevent you from getting pregnant. If you have an issue with the lower part of your cervix, in that it is blocking things from passing through, it is not functioning well, that may also cause some degree of infertility. So as you can see here, there are many different aspects in a female that may influence whether or not you can get pregnant. Out of all of these different things, the most common reason why females may be infertile is right here. The ovaries. Anovulation is the process of not ovulating. And that is one of the top reasons why your ovary may not produce a mature egg as needed for pregnancy to occur. Anovulation can be caused by things like PCOS. That's probably one of the top reasons. Because in PCOS, you're having a state of imbalance, hormonal imbalances. With imbalances due to PCOS, what happens is that all of the eggs that are being produced inside of your ovary, they're getting larger, as they should. You have many of them, as you should. However, none of them are reaching the peak level of size and maturity that will allow your brain, your hypothalamus, and your anterior pituitary to give you the LH surge that you need for the egg to actually release into your body. So what happens in a person with PCOS is that all of these eggs remain trapped inside of the ovary and they don't go anywhere. They literally just remain inside. And this is why we call the condition polycystic ovarian syndrome, because when we take a look by ultrasound, we literally see a lot of eggs and follicles trapped inside of your ovary. And sometimes your ovary may become bigger and bigger and bigger over time with all of the eggs that are just trapped inside. Secondly, having hormonal imbalances may also thicken the outside layer of your ovary. It makes that layer so thick that it's very difficult for the egg to burst through and ovulate out. This is why anovulation, or not ovulating regularly, is one of the top reasons why a female may experience infertility. Now, we have so much more to talk about, and we will, but as you're listening and if you're enjoying our conversation, please go ahead and subscribe to our channel. And if you have any questions or comments, please be sure to share them below. Now, there are other reasons also why you may have infertility due to not ovulating regularly. We've talked about PCOS, which is one of the top reasons, but sometimes we may have other issues as well. For instance, you may have a thyroid disorder. Thyroid disorders may be on either side of having too little or too much hormones being released by your thyroid gland. With that, know that on either side, ovulation may be reduced because of that. It is important that you get your thyroid levels checked on a regular basis, especially when you are trying for pregnancy and having difficulty with it. I've seen many a times that someone with low thyroid, for instance, hypothyroidism, where as soon as they start medications and they get their thyroid levels into a normal level, bam, they start ovulating all over again and they can get pregnant. And so it's very important for us to rule that out and be sure that that's not the reason why you're not getting pregnant at this time. Some people may also have premature ovarian failure. This means that the ovaries have essentially stopped working way before they're supposed to. For instance, I have a patient at this point that this patient is in her early 30s and she has no more eggs left. Her eggs completely depleted, her ovaries have completely failed. The unfortunate thing is that once your eggs have been completely depleted or gone, there's absolutely no way for us to replace them. There's no way to grow new ones, there's no way to get another. That's because we were born with all the eggs that we will ever have for a lifetime. If we lose them early, we've lost them forever. With this patient, she's in her mid-30s, and so unfortunately, her fertility has been completely closed. There's no way for her to get pregnant on her own. Now, while this might not happen to the majority of us, if you've been trying for pregnancy for a very long time and you haven't been able to achieve it, I definitely recommend that you get your levels checked and get to your doctors just to be sure that your levels are normal and your ovaries are functioning like they should. Just on a quick side note, the test that works amazingly to give you an idea of how many eggs you have left is called an AMH test, or anti-Müllerian hormone. You can tell them I told you that, okay? So ask them to please check your AMH level so that you can get more information about how many eggs that you have left in your ovaries. Another cause of anovulation, or not ovulating, can be excessive exercise. This is seen very, very commonly in athletes. Women who work out every day strenuously, they do not have breaks or rest days. And what happens is that all of the hormones from the hypothalamus to the anterior pituitary, they become out of whack and will shut down your ovary. So you're not ovulating. Now, there's so many more reasons why this can happen, but we've talked about the top ones today. I have a wonderful gift for you because this may be very helpful in the process of trying to conceive and trying to understand your ovulation better. This book is called Hormones Don't Lie. And in this, I explained so much more about your hormones, so much more about how to balance them so that you may be able to achieve the life of your dreams. To get this ebook, it's quite simple. Just click the link below, enter your information, and that ebook will be right in your email ready for you. Thank you so much for being with us today. I hope you've learned something. I'm Dr. Perkins, a board-certified OBGYN, and we do this every week, and so please join us. Thank you, and I'll see you next time.